Okay. Now I'm going to be examining your hands. If you can put out your hands. Okay, good. And now I'm looking at your skin. I'm feeling the temperature of the skin. Make sure it's normal. And also the capillary refill, which should be less than 3 seconds, which yours is normal. And also the degree of your nail bed has to be 160-degree angle, which yours is, so that's normal. And now I'm looking at the color, temperature, texture, your skin turgor, which is good. I don't see any swelling or any lesions, which is really good. And now I'm going to assess both of your radial pulses and make sure that both of them are the same and I don't feel anything abnormal. And I'm checking the rate and rhythm bilaterally to make sure that they're normal. And now I'm going to palpate the brachial arteries, which are right here in the antecubital fossa. And the rate and rhythm of these brachial arteries is normal. Okay, now I'm going to check the radial and ulnar patency. So what I'm going to do is the ulnar and radial arteries, I'm going to hold them together and I'm going to be pressing them, and while I press them, I'm going to have you open and close your fist, okay, a few times. Go ahead. Keep doing it. That's good. Your hand is blanching. Your palm is blanching while I'm keeping both of the arteries occluded, closed. And as soon as I let go of the ulnar, I'm going to see the pink color in your hand appear within about 2 to 5 seconds, okay? Alright, I'm going to let go now. Alright, good. Okay, good. That was normal. So the arteries are good. They're functioning very well, which is good. Okay, now I'm going to be checking your legs. So if you can move a little bit back, please. Okay, let me put this down. Actually, let me have you lay down. If you can go ahead and lay down for me. Okay, good. Now I'm going to inspect both legs for any swelling. I'm looking at the color of the skin. I'm looking at the temperature of the skin. And looking at any bruising or swelling, which I haven't noticed any, which is good. And the venous pattern, it looks good. There's no swelling, like I said. No ulcers, no lesions, which is good. I do see little cuts here. Is that from shaving? A little few marks here that I've seen.
You had gone to the forest.
Oh, you went to the forest. Okay, so that's probably from that. You got a little marks there, so it's probably when you were walking around. Okay. Other than that, everything else looks good, which is good. And now the temperature, skin temperature, everything is normal. Now I'm going to be checking your calf for any tenderness on both sides. Let me know if you feel any pain or tenderness. Did you feel any? Did you feel any there? Okay, good. And now I'm going to be checking your lymph nodes, which are right here in the inguinal area. And I'm just going to be palpating them and moving them, making sure I feel them. And they're usually about 1 centimeter or less. They're movable, which is good. They're not tender, which is good. And right below that, since I'm already here, I'm going to be checking your femoral pulse. Checking the rate and rhythm, make sure it's normal. Okay, it's good. Now I'm going to check the pulse in the back of your knees. You can relax. It's the popliteal, your popliteal pulses, and I'm checking both of them systemically, bilaterally. Make sure they're normal, which are good. Now I'm going to check the posterior T-bow pulses, which are right here. They're here. And I'm going to check both of them. They're normal. And now I'm going to check the dorsal pedis, which is in the front of the foot right here. Okay, so that's good. All your pulses were normal. They were regular. The rate was good. And I've checked for any swelling, and now I'm also going to check for another test that we check for swelling. I'm going to take 2 of my fingers, and in the tibial portion, I'm going to press it for 5 seconds and make sure I don't feel any edema or any pitting indentations. Okay, that was normal. No edema or any pits or anything noticed. Now I'm going to have you, if you can stand up, and I'm going to be, turn around. Just press the button. Okay. Just turn around for me. Good. Okay, now I'm just looking at, if you can just hold this. Good. Okay, good. Now I'm looking at your legs, and I'm assessing the veins, making sure there's, no varicose veins or anything abnormal, any lesions, and the veins should not be visible or dilated, which yours are not, which is good. And I'm going to check now for the varicose veins for valve competence by doing the manual compression test. And with the distal finger, there should be no changes. And there isn't on that side. Okay, and the same was on that side. Okay, so I haven't noticed any other swelling or any other lesions or anything else, which is good. Okay, now go ahead and have a seat. All right, thank you very much, Nisha. Do you have any questions or concerns?
No, thank you.
All right, the assessment went very well and everything was within normal range. Okay, thank you. Take care.